Patients here.
Oh boy, got some blood going.
Yeah, there's blood.
Oh, he's wearing it too.
Welcome to the bed. When you get over to the bed, we'll go ahead and give you the story. This is all going to happen super fast. Welcome to the emergency room.
70-year-old female, single driver of a vehicle, appears that she went off-road into a ditch, rolled over her car into a tree, caved in, the top of the vehicle was caved in, so she was hanging out partially from the window. She's been in application for
your left
hand.
45 minutes of CPR. We can stop CPR with 600, 600, 600.
Welcome back to the deep dive. So you're getting ready for your PEDS rotation, you're staring down those big foundational exams, and the school-age child is a huge piece of that puzzle.
It really is.
So today, we're taking all that source material, your textbooks, those CDC schedules, the developmental checklists, and we are boiling it all down. We're going to pull out the most critical, high-yield info you absolutely need to know.
And this age group, the 6 to 12-year-old, is, well, it's arguably one of the most important transitions to understand. We sometimes call it the era of industry.
Or the calm before the storm. I've heard that one too.
Right, the calm before the teenage storm. You get the slow, steady physical growth, which is a nice break after the toddler years. But at the same time, their social and cognitive growth is just exploding. It's accelerated.
And that's the core of it for nursing, isn't it? That transition. Their whole world shifts.
Completely. They go from being totally focused on the family to a world that's, dominated by their friends, by school, by teachers, by coaches.
So if you, our listener, are looking for that one single thread, that one idea that connects everything we're about to talk about today, what is it?
It's Erikson's core stage for this age. Industry versus inferiority.
Okay.
That is your clinical lens. Everything. Play, safety, how they handle being sick.
Yeah.
It all revolves around this fundamental drive they have for competence, for mastery.
They want to be good at things.
They need to be good at things. If you get that, you get the school-age child.
Perfect. So that's our mission today. We're going to use that industry lens to connect all the dots for you. We'll cover vitals, development, immunizations, play, and of course, the huge topic of safety.
Let's jump right in with the body itself, the physiology.
Okay, so physiologically, the big theme here seems to be things slowing down, but also maturing.
That's a great way to put it. Think deceleration in terms of rates, but maturation in terms of function. The body is just getting more efficient, it's refining itself, moving closer and closer to adult norms.
I see that phrase, slow, progressive physical growth, in all the textbooks. So let's break that down. Which systems are really making a big leap during this time?
Well, the neurologic system is a fantastic place to start. The brain itself, it's already about 90% of its adult size by age 5. So the actual growth of the brain and the skull slows way down.
Right.
But that physical slowdown allows for this incredible functional development. The wiring is getting optimized. Myelination of the nerve fibers is continuing, and that's what allows for faster processing for the complex thinking we'll talk about with Piaget.
So the hardware is basically in place, and now it's all about upgrading the software and the connection speed.
Exactly. Which leads us to the immune system. This is a huge high-yield point for any nursing student.
The number of sick visits just plummets, doesn't it?
It really does. And here's the clinical fact you need to remember. The immune system matures to an adult level right around 10 years old.
10 years old. Okay.
So think about it. The preschooler you saw last week was in for their, 5th year infection?
Right. It's just a constant cycle.
But by 10, their immune system is fully competent. They've been exposed to a lot. They've built up antibodies, so they get far fewer colds, fewer stomach bugs, fewer infections in general.
Which means if a 10-year-old is coming in with constant nagging infections, that's a bit of a red flag for you. It's not just a kid thing anymore.
Precisely. It warrants a deeper look. And this shift also means that the leading cause of, morbidity and mortality, it moves away from infectious disease and moves squarely into the category of unintentional injuries.
Which we will definitely get to in the safety section.
Yep.
What about the musculoskeletal system? They look so much more coordinated. They're playing sports, but you're saying there's a hidden vulnerability.
There is. Their coordination and strength are increasing like crazy. They can run, jump, swim, all of that. But the internal structure is still immature.
What does that mean specifically?
Specifically, we're talking about the growth plates, the epiphyseal plates at the ends of their long bones. They're still open, they're still soft, they're relatively weak, until they finish puberty.
So their muscles might actually be stronger than their bones at certain points.
That's the risk. The muscle strength can outpace the bone's structural integrity. This makes them super prone to injuries during sports, especially fractures right at that growth plate, which can be a serious problem.
So you can't treat a 10-year-old athlete like a mini adult athlete.
You absolutely cannot. The whole safety approach has to be different.
Okay, let's translate this maturation into the hard numbers, the vital signs. This is so testable. What's the overall trend?
The trend is simple. Heart rate and respiratory rate go down, and blood pressure goes up. The body is bigger, it's more efficient, it doesn't have to work as hard at rest.
So let's compare. A preschooler versus our school-age kid. Let's start with pulse rate.
Okay, for a preschooler, you're looking at a range of, say, 70 to 120 beats per minute. For the school-age child, that slows down to about 60 to 110.
So a heart rate of 115, which is totally fine in a 4-year-old, might make you raise an eyebrow in a 9-year-old.
It should, yeah. It's on the high end of normal. You'd want to watch that.
And respirations, do they drop as much?
They also slow down a bit, usually hovering in the 20 to 25 breaths per minute range. But the really critical change here, and exam writers love this detail, is the way they breathe.
Okay.
It becomes diaphragmatic, abdominal breathing. They're moving away from that chest wall, accessory muscle breathing you see in younger kids. It's just another sign of a more mature, more efficient respiratory system.
So if you see a calm 10-year-old with retractions or using their neck muscles to breathe, that's a significant sign of distress.
A very significant sign. They shouldn't need to work that hard. Now, the one that goes the other way is blood pressure.
Right. It starts to climb.
It does. It moves toward adult norms, which reflects their bigger body mass and increased vascular resistance.
Can you give us a general range to keep in mind?
Well, it is very age and sex dependent, but generally systolic for boys is around 96 to 106, and for girls maybe 94 to 105. Diastolic for both is in that 55 to 62 range.
The key takeaway for a student isn't to memorize every single number, but to know the trend.
Know the trend. On a pediatric BP chart, this is the age where that line starts a clear, steady climb upwards.
And thank goodness temperature taking gets easier.
Finally. Yes, we can reliably switch to the oral route usually around age 7, once they can cooperate and hold it under their tongue safely. The temp itself is very stable, right around 37 Celsius or 98.6 Fahrenheit.
Okay, before we wrap this section, that clinical calculation tip for bladder capacity, it's so practical.
It is, and you'll use it all the time. The formula is simple. Age in years plus 2 equals the capacity in ounces.
So a 10-year-old has about a 12-ounce bladder capacity.
Exactly. And that's critical for you when you're assessing urine output, calculating IV fluids, or figuring out if a child is in urinary retention. It gives you a baseline for what to expect.
That's incredibly useful.
Okay.
Let's synthesize this section for everyone studying.
All right. So, what nurses watch for? You're watching for any sudden jump in heart rate or respiratory rate, remembering their baseline is way slower than a toddler's. You're also starting to watch for signs of prepubescence toward the end of this stage, around 10 or 12.
And why is that important from a nursing perspective?
Because their bodies might start to look more mature, but their brain is still that of a 10-year-old. You have to base your communication and your expectations on their cognitive age, not their physical appearance.
That's a great point. And what exam writers love to test.
They love the maturation points, the immune system hitting adult levels around age 10, and they love the vital sign trends, heart rate and respirations down, BP up. They'll give you a scenario and ask if the vitals are normal for the age.
Okay, and finally, one easy way to remember this age group.
Their body is running like a more efficient car, lower RPMs at idle, but the frame is still under construction. The driver, the brain, needs to be extra cautious.
That's a perfect transition. The body's on a slower, steadier track, which means all that energy can be focused outward, focused on the world.
And focused on success in that world. This is where we get to Erikson's industry versus inferiority.
Okay, so if the preschooler's job was initiative, just starting things, the school-age child's job is what?
It's production. Their entire developmental drive is to achieve a sense of personal competence. That's what industry means.
So if they're in the hospital, their self-esteem, their whole sense of self is tied to their ability to do stuff.
To contribute, to master things, to achieve. Success for them is getting a good grade, scoring a goal, even just completing a chore correctly. So as nurses, we have to tap into that. We have to give them opportunities for industry.
Give me a concrete example of that on the pediatric floor.
Okay, so instead of just silently measuring their fluid intake, you give them the chart and a pen. You say, your job is to be my official hydrator. I need you to mark this sheet every time you finish a cup of water.
You're giving them a role, a job.
Exactly. You're making them a partner. They crave that responsibility. They need to feel helpful and competent, especially when so much else feels out of their control.
And the flip side of that coin is inferiority. How does that manifest?
It's a profound danger. Inferiority is what happens when the tasks are too hard, when the goals are too high, and the child just feels like a failure. They feel inadequate, worthless even.
And school is a huge breeding ground for that.
A huge one. If a child is struggling with reading or they're not good at sports and they're constantly reminded of that, that feeling of being less than can just take over their whole self-concept.
So our job is to help set them up for success, for small wins.
Always set achievable goals.
This connects directly to how they think, right? To Piaget's stage.
Absolutely. We're now in the concrete operational stage, usually from about age 7 to 11.
Concrete, that's the key word.
It is. This is the beginning of logical, organized thought. They can understand processes, they can follow steps, they can classify things. It unlocks so much for our health teaching.
But there's a huge limitation that you mentioned earlier.
The huge limitation is that they still cannot think abstractly. Everything has to be concrete, tangible, and related to the here and now.
So what's the clinical implication there? How does that change how you teach?
It means you can't talk about long-term abstract consequences. Telling an 8-year-old smoking might give you cancer in 40 years is, meaningless.
It's too far away, too abstract.
Right. But if you tell that same child, if you don't use your asthma inhaler correctly, you won't be able to play in the soccer game tomorrow, that's concrete. That's immediate. And it directly impacts their drive for industry.
Let's hit that classic skill they master in this stage, conservation.
Yes. Conservation is a huge cognitive leap. It's the understanding that the amount or volume of something stays the same, even if you change its shape or appearance.
The classic water glass test.
A classic test. You pour water from a short, fat glass into a tall, skinny glass. A preschooler will say the tall glass has more water, but the school-age child who has mastered conservation knows it's the same amount. They can mentally reverse the action.
That ability to mentally manipulate things is the core of it all.
It is, and they're also learning to tell time, they understand reversibility, and crucially, they become much less egocentric.
They can finally see things from someone else's perspective.
You genuinely see it, yes.
Right.
Which is the foundation for empathy, for teamwork, for following rules in a game.
And all of this plays out in their physical milestones, too. It's not just running and jumping anymore.
No, the gross motor skills get very refined, which is why organized sports become so popular. But the real expression of industry is often in their fine motor skills.
How so?
Their dexterity improves so much that they take incredible pride in activities that require precision.
Like what?
Like neat handwriting, building complex Lego models, learning a musical instrument, drawing detailed pictures. They love to show you what they've made.
So if you notice a child is really avoiding those kinds of tasks, that could be a clue.
A big one. Which brings us to a major developmental warning sign we have to screen for: vision problems.
Because if you can't see well, you can't succeed in school. You can't achieve industry.
Exactly. So you, as the nurse, need to watch for the signs. Eye rubbing, squinting, headaches after school, holding a book super close to their face. Any of those are red flags.
Let's do a quick deep dive on amblyopia, the lazy eye.
Yeah.
Because that's such a classic issue for this age.
Right. And it's not just a weak eye. Amblyopia is when the brain starts to ignore or suppress the visual input from one eye.
Why would it do that?
It's usually because the image from that eye is blurry, maybe from a refractive error or misaligned, which is called strabismus. To avoid double vision, the brain just says, nope, I'm only listening to the good eye.
And if that goes on for too long?
The vision loss in that suppressed eye can become permanent. The critical window for visual development is still open.
So the intervention is patching.
Patching the strong eye, yes. You have to force the brain to use the weaker eye to build up those neural pathways.
Which I imagine a 9-year-old is not a huge fan of.
They hate it. Compliance is the #1 challenge. So again, you leverage industry. You don't just say, wear this. You say, your job for the next 4 hours is to be an eye trainer. By wearing this patch, you're doing the hard work to make your eye stronger so you can see better for video games.
Frame it as a task to be mastered.
Always.
Okay, let's wrap up development. What's the bottom line here?
All right. What nurses watch for? You're looking for signs of inferiority. Is the child withdrawn? Are they always saying, I can't do it? Are they avoiding school or group activities? Those are major psychosocial red flags. And, of course, screen for vision problems aggressively.
And for our students studying for exams, what exam writers love to test?
They love to test the difference between concrete operations and industry versus inferiority. They'll give you a scenario about teaching a child and ask you to pick the best approach based on their concrete, non-abstract thinking.
And your memory trick. One easy way to remember this age group.
Their whole world revolves around CIP. They've mastered conservation, they're driven by industry, and they're learning perspective taking.
Okay, let's move into clinical prevention. This is where the rubber meets the road. And we have to start with the immunization schedule. It feels like this age group is caught between two big vaccine pushes.
That's a good way to describe it. They're finishing up the early childhood series and just about to start the adolescent series, so there are two key moments to know for your exams.
The first one is right before they start school, right?
Yes, the post-preschool boosters.
Yeah.
This is that 4 to 6-year-old checkup. It's usually the 5th dose of DTaP, 4th IPV, and the 2nd doses of MMR and varicella.
And there's a key clinical detail about DTaP if a child is a little behind schedule.
A very important one. If a child is 7 years or older and needs a tetanus, diphtheria, pertussis vaccine, you do not give them DTaP. You switch to Tdap.
Why is that?
DTaP has a higher dose of the diphtheria and pertussis antigens, which can cause more significant reactions in older kids and adults. By age 7, Tdap is enough to boost their immunity without the increased side effect risk.
Got it. Okay, now for the second big moment. The big 11 to 12-year set. The middle school shots.
Right. There are 3 critical vaccines here. First is Tdap. This is their 1-dose adolescent booster. And the big rationale here is that immunity from their childhood shots starts to wane. This protects them and others from things like whooping cough.
And there is a super high-yield clinical fact about Tdap and pregnancy. You see this on exams all the time.
All the time. The rule is Tdap is recommended during every single pregnancy.
Every single one.
Yes, usually between 27 and 36 weeks. And it doesn't matter when her last Tdap was. The reason is to protect the baby. The mother creates antibodies that cross the placenta and give the newborn passive immunity to pertussis, which can be deadly for them.
The mother is cocooning the baby with her own immunity.
That's a perfect way to think about it.
Okay, second vaccine in that set.
HPV, the human papillomavirus vaccine. The goal is to give it before any potential exposure because it prevents the majority of cancers caused by HPV.
The dosing can be a little tricky.
It can. But the rule is pretty simple. If you start the series between ages 9 and 14, it's a 2-dose series. If you wait until they're 15 or older, or if they're immunocompromised, it becomes a 3-dose series.
Simple enough. And the third one.
Menin-T-WY, the meningococcal vaccine. This is to protect against bacterial meningitis, which can be devastatingly fast and fatal.
And this is a 2-dose series as well, but spread out.
Yes. Dose 1 is at 11 to 12 years, and the crucial booster dose is given at age 16, just in time for them to be heading into more crowded environments like college dorms.
Okay, let's quickly hit the absolute contraindications, the never-ever-give situations.
There are a few you have to know cold. First, a severe allergic reaction, anaphylaxis, to a previous dose is an absolute contraindication.
Obvious, but critical.
Right. Second, and this is specific to DTaP or Tdap, if a child had encephalopathy, a severe brain issue like a coma or prolonged seizures, within 7 days of a previous dose, they should not get any more pertussis-containing vaccines.
Okay, that's very specific.
And third, for the live vaccines, which are MMR and varicella, they are absolutely contraindicated in anyone who is severely immunocompromised or who is pregnant.
Got it. And what if a patient is just way behind schedule on everything? Do you start over?
No, that's the golden rule. You never need to restart a series. You just pick up where they left off and follow the minimum interval guidelines.
That's a huge relief.
Yeah.
Okay, let's pivot from shots to play, which for this age group is basically their work.
It's totally their work. It's how they achieve industry. And play shifts from the parallel play of toddlers to being primarily cooperative and competitive.
They want games with rules.
They love games with rules.
Mm.
It reflects their new cognitive ability to handle logic and sequencing. It's not just about the fun of the action anymore. It's about the challenge of winning according to the structure.
What are the benefits of that kind of structured play?
Oh, they're huge. Physically, it helps with fitness, weight management, but psychosocially, this is where they learn teamwork, leadership, compromise, negotiation. They learn that to succeed as a group, everyone has to follow the rules.
So what are some age-appropriate recommendations a nurse can make?
Well, organized sports are fantastic, but so are things like simple board games or card games, activities that involve collecting and organizing, like stamps or cards, or building complex models. Anything that requires skill, planning, and following a set of rules is perfect.
So synthesizing this section, what's the takeaway?
All right, what nurses watch for? A lack of interest in these cooperative or competitive games. A child who can't seem to follow rules or who avoids all group activities might be struggling with social skills, or it could be a sign of low self-esteem. That inferiority piece again.
And what exam writers love to test?
They hammer the 11 to 12-year-old vaccine schedule. Tdap, HPV, many and ACWI, know those. And know the absolute contraindications, especially the Tdap and pregnancy rule versus the live vaccines and pregnancy rule.
Finally, one easy way to remember this age group.
They need their THM, Tdap, HPV, many ACWI before they become teens. And their play is all about learning the rules.
All right, our final section, and it is a big one. Safety. We've set the stage perfectly. They're capable, they're logical in a concrete way, they're independent.
But their judgment is still immature. Their ability to think about abstract risk and long-term consequences just isn't there yet, and that creates a perfect storm for unintentional injuries.
Which you said earlier is the leading cause of death in this age group.
It is, tragically. So the anticipatory guidance we provide as nurses here is life-saving. It's not optional.
Let's start with the one that is on every single exam. Car and pedestrian safety, and the infamous booster seat rule.
Yes, if you remember one thing from this section, remember this. A child needs to be in a booster seat until they are at least 4 feet 9 inches tall. That's 144.8 centimeters.
4'9". And this is typically somewhere between 8 and 12 years old, so it's not about age, it's about height.
It is 100% about height. Let's talk about the physics of why that matters.
Please do.
When a child is shorter than 4'9", the adult lat belt doesn't sit on their strong hip bones. It rides up onto their soft abdomen. In a crash, that belt can cause catastrophic internal injuries to the organs and the spine.
That's horrifying.
It is. The booster seat simply elevates them so the lat belt stays low on the hips, and the shoulder belt crosses the chest and shoulder, not their neck or their face. The belt has to engage the skeleton, not the soft tissue.
And they should always be in the back seat until what age?
Until age 13. No exceptions.
Okay, that is crystal clear. Now, what about when they're outside the car? Pedestrian safety. They're walking to a friend's house alone for the first time.
But their brain isn't fully ready for that task. They can parrot back the rule, look left, right, then left again. But what they can't do, especially under age 10, is accurately judge the speed and distance of an oncoming car.
So they see the car, but they have no real concept of how fast it's closing in.
Exactly. Their concrete thinking doesn't handle that kind of complex real-time calculation well, so they need continued supervision when crossing busy streets.
Okay, let's move to sports and bikes. Again, their coordination is better, but the risk is still there.
The risk is high because they're attempting more daring things. So for bicycle safety, 2 things are non-negotiable. 1, the bike has to fit. They should be able to sit on the seat and have the balls of their feet touch the ground.
And 2,
helmets, every single time, for any wheeled sport. Bikes, scooters, skateboards, you name it, a helmet is mandatory. Plus other padding for knees and elbows.
And this goes back to protecting those vulnerable growth plates we talked about.
It does. The equipment helps absorb and distribute the force of a fall, protecting not just their head, but their entire immature skeletal structure.
Okay, let's talk about risks inside the home. Fire safety.
This is a great place to leverage their concrete thinking. They can learn and practice a plan.
So what do you teach?
Every home needs working smoke detectors, check the batteries twice a year, and crucially, you have to create and physically practice a fire escape plan with a designated meeting spot outside.
They need to walk through the steps.
Yes. And they need to know the concrete actions. Stop, drop, and roll. Call 911. And any chores involving heat, like cooking, still need adult supervision.
What about water safety? They're becoming stronger swimmers.
But supervision is still the #1 rule. Never swim alone. ever. And they need to be taught never to dive into water if they don't know how deep it is. That's a huge risk for spinal cord injuries. And parents need to know CPR.
Okay, and then the big two that require locking things up, toxins and firearms.
Right. All poisons, chemicals, cleaning supplies need to be in a locked cabinet. And for firearms, the teaching has to be incredibly specific and direct.
It's a rule.
The firearms and the ammunition must be stored separately, and both must be in locked containers. And you teach the child a very simple, concrete rule. If you see a gun, you do not touch it. You leave the area, you find an adult immediately.
No ambiguity there.
None.
Let's shift to the modern risks. The screen is their new playground.
It is, and it's where they go to find social connection and a sense of competence, so we have to manage it. Parents need to set firm time limits and monitor the content. And a huge safety tip: keep computers and gaming consoles in a common area of the house.
Not in the bedroom.
Not in the bedroom, where supervision is impossible.
And what are the key internet safety rules you teach?
Never, ever share personal information, your full name, your school, your address. Never agree to meet someone in person that you've only met online. And teach them that if a message ever makes them feel weird or sad or scared, they show an adult right away.
Okay, and let's end with the two major psychosocial risks that just devastate a child's sense of industry: abuse and bullying.
These have to be part of every single nursing assessment. For abuse, you're looking for injuries that don't match the story, or big behavioral changes like a child who suddenly starts wetting the bed again or refusing to go to school.
And bullying, it's the ultimate attack on their competence.
It is. Bullying, whether it's physical or verbal or online, it's designed to make the victim feel worthless. It is the direct cause of inferiority for so many kids. It can lead to anxiety, depression, a total withdrawal from the world.
So how do you screen for it when they're often too ashamed to talk about it?
You have to ask directly but gently. How are things at school? Who do you sit with at lunch? Is anyone ever mean to you? And you have to screen both ways. It's important to remember that the child who is doing the bullying is often also struggling with feelings of inferiority and is trying to feel powerful. They need help too.
That brings us all full circle. Okay, let's wrap up this vital section.
What nurses watch for? You're looking for patterns, frequent injuries, unexplained behavioral changes, lying, stealing, school refusal. These are often signs of a deeper stressor, like bullying or abuse, that is crushing their sense of industry.
And what exam writers love to test?
The car safety rules. They will test you on that 4'9" height requirement and the backseat until 13 rule. And they love scenarios that force you to connect the child's growing independence with their growing risk for accidents.
And finally, one easy way to remember this age group's safety needs.
Their confidence is growing, but their judgment isn't. So safety is about protecting them from that gap. Think of it as keeping them safe. Screening for bullying, activity matched to ability, firearm safety, and the elevation rule for car seats 4'9". #tag outro. So that was our deep dive into the school-age child. We've really tried to frame this whole era through that critical lens of industry versus inferiority, because that drive for competence explains so much of their behavior.
Right. We saw that their bodies are actually slowing down and becoming more efficient. That means a lower heart rate, lower respiratory rate, but a climbing blood pressure. And don't forget that key milestone. The immune system matures around age 10.
And developmentally, their mind is making huge leaps. They're in that concrete operational stage, which means they can think logically, they've mastered conservation, but they still can't grasp those big abstract ideas about the future.
So remember those high-yield screening areas for your practice.
Mm-hmm.
You absolutely have to screen for vision problems like amblyopia. You have to assess for psychosocial issues like bullying. And please hammer home that 4'9" rule for car safety.
And just as a final clinical pearl, remember how powerful that drive for industry is. When you have a school-age child as a patient, make them a partner. Give them a job to do, no matter how small. It's not just a distraction. It's about preserving their fundamental sense of self-worth while they're sick.
And that leads us to our final thought for you to take with you. We know this age group can understand rules and immediate consequences because of their concrete thinking.
Mm-hmm.
As nurses, so often we teach by just giving orders. You need to do this.
Mm-hmm.
But given their intense desire for industry, for mastery, for being part of the team, how can we change that? How can we leverage that new logical brain to engage them in real shared decision-making, especially with things like managing a chronic illness? Moving beyond just telling them what to do to building a partnership based on competence. What new doors does this era of industry really open for your nursing practice?
That's a great question to think about as you head to the bedside. Thanks for diving deep with us.
See you next time.